Fellow Kenyans, yesterday afternoon, I gave an update on the status of the coronavirus disease, confirming 7 cases of the disease in Kenya. Of the 7, 6 are Kenyans, while the remaining one is a Burundian national. All the 7 are doing well under the observation of the Ministry of Health and Kenyatta National Hospital staff. It is important to note that all these cases have been imported from outside the country. Ladies and gentlemen, in the last 24 hours, we have screened and tested another 8 cases, all of which have turned out negative and are being processed as we speak to be discharged to go home. So this is good news that today we are not reporting any increase in the positive cases that we have in the country. We are, however, continuing with tests and contact tracing, and we have already contacted 145 people who have come into contact with persons who have tested positive for the virus. It is also worth noting, I think, that we have screened over 600,000 people who have entered our country in all our entry points. I wanted to make this clear because yesterday I had a discussion on one of the TV stations where somebody said that we have screened 32 people. I think it is very important to separate between screening and testing and then confirming. It's a very important distinction, because I think somewhere along the line we are missing out the point, and perhaps we should take responsibility because we are the ones communicating the same. We have tested, so we have screened over 600,000 people at the airport and elsewhere. Some of you were there when we were doing screening in the Ongata-Ongai area. We have tested 173 people, out of which 7 are the ones who have turned out positive. Fellow Kenyans, the good news is that the 7 patients are in stable conditions. And indeed, today, we began the test to see whether any of them might have turned positive. This is something that we will be discussing again, turned negative. This is something that we'll be discussing again tomorrow. However, we continue to appeal to Kenyans in order to break the chain of transmission of this virus. We continue to maintain high standards of hygiene as we have advised. To this effect, the government has directed the involvement of the Nyumba Kumi leaders, sub-chiefs, and chiefs in ensuring compliance to these directives, but also in creating the smallest units in terms of the management of the disease. The purpose of invoking the Nyumba Kumis and the sub-chiefs is that if there is a problem within that area, the sub-chiefs and the chiefs would know very quickly in which Nyumba Kumi there is a problem. Now, this we want the citizens to take very seriously. And I want to say, ladies and gentlemen, that as much as a lot of our people are not taking it lightly, there are those people, skeptics, who continue to pour doubt as to the seriousness of our situation. I urge you to continue as members of the Fourth Estate, I urge you to continue to educate and affirm that this situation is real.